Well, good morning, everyone. Thank you for attending today's webinar. And my name is Tim Shook, Vice President of Cornerstone Senior Marketing, and really do appreciate everyone listening in today's presentation. Today, we're going to talk about two actually really important activities that are going to be going on as we speak currently, going in throughout the rest of this year. The Medicare Advantage open enrollment, which is going on now, and then also talk about star ratings. We're not as used to seeing star ratings specifically here in Ohio, but you'll see as we go through the presentation that this is the most five-star plans available ever with Medicare. So carriers are putting together quality programs, and what it basically does for you is it gives you opportunities to for year-round selling and that. So with that, I'm going to go ahead and get started. All lines are muted, so if you have any questions, please put them in the Q&A box or the chat feature. We'll try to answer those questions as we go along. Marilyn, if you could help me with those questions, that would be wonderful. And then at the end, if any other specific questions, just let us know. We're here to educate. We're here to make sure that you understand these opportunities and present this with some selling opportunities for you for this year. So with that, we're going to go ahead and get started. So the outline, again, we're going to talk about first part we're going to talk about is the OEP open enrollment period. We're going to look at the beneficiary options. What are your options during OEP? We're going to look at some marketing guidelines too. It's always important, if there's an opportunity, how can we market to take advantage of an opportunity? So we're going to look at the do's and don'ts for agents. And then also we're going to look at some specific examples. We get a lot of questions here at Cornerstone, so we kind of turn some of these questions that we get into some questions so you can see specifically, hopefully these will answer some of the questions that you may have. And then after that, we're going to look into a little bit more into star ratings. Again, as I mentioned before, this is the most five-star rating plans across the country this year for 2022. And many of you may not be familiar with how to market or what are the opportunities. So we're going to look at, first of all, what are Medicare star ratings, how are they measured, some of the categories that's looked at, the rating distribution by plan enrollment. We're going to really dig a little deeper into the five-star rating. What is the SEP, and how do you use it? What is the opportunity? We're going to also take a look at enrollment periods, just one slide on just the overall enrollment periods that are available throughout the year. And then again, what's important is what are the marketing limitations? How can we go after some of these clients that are not on a five-star plan today? So with this, we're going to go ahead and get started on the Medicare Advantage open enrollment. So OEP, as many as you are aware, this was a result of that 21st Century Cures Act. And this was actually signed into law by Obama on December the 13th, 2016. And it's replacing the disenrollment period. If you remember, the disenrollment period was from January 1st to February 14th. A shorter time window, basically 45 days, an individual could move from, they were not happy with their Medicare Advantage plan that they signed up for either during AEP or that they were currently on, they could disenroll during that time period. But starting in 2019, this OEP period now goes from January 1st to March 31st. And it really is going to address individuals that's on a Medicare Advantage plan today that they may not be happy with. If they enrolled during AEP or not, as long as they're on a Medicare Advantage plan, then they have an opportunity to use an SEP, or which is the OEP, to change to a different Medicare Advantage plan. They can go to a Medicare Advantage plan with or without drug coverage, or if they are not happy with a Medicare Advantage plan at all, they can disenroll altogether from a Medicare Advantage plan, go to a original Medicare, and then also would give the ability for them to sign up with a PDP plan. So when do the effective, if you're doing a plan election for OEP, when do those actually go into effect? And those do go in effect. It's first of the month following the month that the application was received by the carrier. So, for example, if you submit an application for an SEP OEP in January and it's received, the effective date would be February 1st. Same as if it's received by the carrier in February, it would be a March 1st. If it's received in March, it would be an April 1st effective date. And again, I'll reiterate that, who can use the MA OEP option. These are individuals that are currently enrolled into an MAPD plan or a Medicare Advantage with no PDP, with no prescription drug coverage. Those are the individuals that would have the opportunity to make a switch using the OEP SEP. We do get a lot of questions from agents about, if someone's on a PDP plan and they're not happy, or they didn't make an election, they're stuck on the same plan, they didn't make election during AEP. Again, it's not going to be, they're not going to be able to use OEP to switch from a PDP plan to a different PDP plan. So again, some of the changes that you can be made during MA OEP, and again, I kind of went over this already, but if you're enrolled into an MAPD plan, you can use OEP to go to a different MAPD plan, an MA only plan, or original Medicare with or without a PDP plan. It's your option. Now, if someone goes to original Medicare and does not elect a PDP plan, as you know, they would incur a penalty there. So we just need to make sure that if they are going back to original Medicare, that we're taking care of the PDP side of things. And then also individuals enrolled, if they're enrolled in the MA plan, again, as I mentioned at the beginning, it's if they are in any type of Medicare Advantage plan, that gives them the option to go to a different plan. So if you have a client that's on an MA only plan and they are looking for that prescription drug coverage, you can rewrite them using OEP to go to a Medicare Advantage plan with prescription drug coverage. Or again, they have the option to go back to original Medicare, and then you can sign them up for a PDP plan. So what type of changes are not allowed during OEP? And again, the key thing I'll keep bringing up is they have to be on a Medicare Advantage plan. Individuals, if they're enrolled in original Medicare and they want to join a Medicare Advantage plan or MAPD plan, they cannot use the OEP, the SEP code OEP to join a Medicare Advantage plan. Or if they're on original Medicare, they can't add a PDP plan during that time frame. It is also not available. I know there are some Medicare savings accounts like Lasso out there. If you have an individual enrolled into a Medicare savings account, or even cost plans or those PACE plans, they're not available to use OEP to move those individuals as well. And the key is there's only one election. You can only use that OEP one time during the January 1st through March 31st. And if you make a move to a different plan and you're not happy with that plan, you would have to have a different SEP to qualify to switch either back to the original plan or to a different plan. Some of the marketing guidelines, these are things that you cannot do, and they're very specific on you can't send unsolicited materials advertising the opportunity to make an additional enrollment change or referencing OEP. You can't go out and specifically say if you're not happy with your Medicare Advantage plan, there is an OEP available to make a change. If you had a current client that you lost during AEP, you're not. It's not allowed to go back and market a former enrollee if they selected a different plan during AEP if you're no longer the agent. You're not able to engage or promote agent broker activities that target OEP as an opportunity to make further sales. If somebody, you also specifically can't target beneficiaries who are in OEP because they made a choice during AEP. by purchasing a mailing list or other means of identification. So it's very specific on you. If you're going to talk about enrollment periods like OEP, you have to talk about all of the enrollment periods. You can't specifically break out and target OEP. But some of the guidelines that you can do during OEP is obviously you can focus on the SEP elections, such as individuals turning 65, if they're relocating where they're no longer eligible to stay on a current plan, or if they're working longer and they're just losing their group coverage, things like that. This is something you've always can do, even outside of OEP. We're going to talk about this a little bit later, but marketing any 5-star related plans in your region or area as well. So you can do that throughout the rest of this year as well. The DSNP market or LIS market, that is always an opportunity. You can make one change each quarter for the first 9 months of the year, and then you're not able to do it during AEP there. If the beneficiary requests, you can send them marketing materials, have one-on-one meetings to provide information on the OEP. And then you can also include general information on your website about enrollment periods, including OEP. Again, they don't want you to specifically break out any one enrollment period. So if you're going to talk about OEP, you need to talk about all the different enrollment periods. So let's look at some of the examples here. There's just a few of them here, and we'll just kind of run through them just to kind of reiterate or summary a little bit of what we just talked about. So we have an individual, Mr. B, who is enrolled into a Medicare Advantage plan, and this person enrolled during AEP. He used the MA AEP to switch to a new MA plan effective January 1st. Unfortunately, a few of his drugs are not in his plan's formulary, and his doctor is out of network. So in this situation here, because he is on a Medicare Advantage plan, he can use the OEP election period. Again, it goes from January 1st to March 31st to change plans with a effective date. Again, if it changes it in January, it will be effective February 1st. And the latest effective date you can get is if you submitted an application in March, the latest effective date you can get is a April 1st effective date. This one, we get a lot of questions on this, specifically where we saw a lot of movement on the PDP side of things. So for this example, client A did not make any changes during AEP, and the PDP plan in which they were enrolled migrated to a different PDP plan with the same carrier. And we saw this a lot where the premium was really low and then it moved to a real high premium. So what options does this client have to change their PDP during OEP? And basically, there are no options. They do not have a qualifying SEP. They qualify an SEP during OEP. Now, if they moved out of the area or had a different qualifying event that would qualify for an SEP, then that would be the option that you could move them. But if they just didn't make a change and they're not happy with the premium they're paying or their overall plan, they would have to wait till the next AEP unless they would have a different qualifying SEP. So in summary on the on OEP, so brokers, basically as an agent or broker, you cannot knowingly target specific individuals during this time period. It includes targeting or sending any unsolicited marketing materials by telephone, direct mail, social media, or email. It's basically this opportunity. It ultimately must be initiated by the member. However, if a beneficiary contacts you and asks you about eligibility to enroll into a plan, you can review their information, utilize OEP to help them with their plan change. This is a good opportunity to contact your current clients just to make sure like they got their ID cards and things like that. If they do say something to you about they're not happy with the plan or something may have changed or they've seen a new provider and it may not be in the network, it gives you an excellent opportunity to make sure that you can rewrite them to a different Medicare Advantage plan during OEP. And another point I'll make out to beneficiary, you cannot switch from a Medicare supplement to an MAPD plan or switch from one PDP plan to another PDP plan using that SEP OEP there. So again, they would have to have another qualifying, a different qualifying event in order to make that change. So Marilyn, I don't know if there were any questions during that that side of the presentation or not, but
okay, I didn't see anything pop up yet. So, but everybody, please feel free to put any questions you have in the Q&A or the chat box, and we'll continue to monitor that. Thanks, Tim.
Okay, thanks, Marilyn. The second piece I want to talk about are Medicare star ratings. As mentioned earlier, we've not really had an opportunity to market, 5-star plans specifically here in the Midwest, but it's there are more and more carriers that are qualifying for 5-star plans, so there's definitely an opportunity there. There are 5-star plans available in 1,626 counties across the country. It's across 44 states, and again, it's the most 5-star plans there's ever been, in a plan year. When you look at the counties that the 5-star plans are available, there are just over 30 million individuals that are in a Medicare Advantage plan that is less than 5 stars. So there's definitely an opportunity to move somebody to a 5-star plan during this time frame. So just a little bit of information on the star ratings. It began back in 2007 as a way for CMS to focus on improving plans and enable Medicare beneficiaries to compare plans. So when you think of it overall, it's a rating system to help consumers purchase insurance or make a decision, basically whether it's on their own or with an agent. But it's an overall rating system to say, hey, this is the overall quality of a plan. Just because it is a 5-star plan, and you'll see as we go through the presentation, doesn't mean it's always going to be the best fit for a client. Because obviously, you can be a 5-star plan and a doctor, hospital, or even prescription drugs may not be it may not be covered or in the network. So again, doing your due diligence just because it's a 5-star plan may not be the best option for an individual. It is set up to reward carriers when they receive 5 stars. So basically, the higher the stars that a carrier receives for their plan, the more they receive an annual bonus. And that bonus allows them, they're only required if they do get this bonus, I think it's for 3 stars or above, but the higher the stars, all the way up to 5 stars, the more bonus money that they get. When they do receive this money, they are required to invest this back into the plans. That's why you're seeing so many additional benefits added to the Medicare Advantage plans. If you look just a few years ago and compare the plans to what they are today, big differences, big additional optional supplemental benefits and things like that that's included. They were not included years ago. The star rating system does support CMS efforts to empower people to make healthcare decisions. So overall, it's that rating system to make people comfortable that, hey, this is overall a good plan. So when we look at, okay, what is measured? So, and some of this stuff will make a lot of sense to you as we go through it. So depending on if it's a Medicare Advantage plan or a Medicare Advantage plan with a Part D prescription drug benefit or just a standalone Part D plan, there are 30 different topics within 5 different categories for just Medicare Advantage plans alone. And 14 topics with 4 categories in a Part D prescription drug plan. And then when you look at a Medicare Advantage plan with Part D that's included in it, there's more than 45 topics that they're looking at in 9 different categories. And these are all coming from just member surveys, the overall Medicare's regular monitoring of the plans program, information plans, healthcare providers, they submit to Medicare, billing and other drug coverage that submits to Medicare as well. We're going to get into a little bit more detail on this here. So here are the overall measures. So like for someone with a plan that's selling Medicare Advantage, they're obviously going to look at the overall member experience. How well are they taking care of their members, their overall customer service. If there are member complaints, how quickly are the plans responding to those complaints and getting those taken care of? And then also, how well do they manage chronic conditions and wellness programs under the Staying Healthy? So you can kind of see like more and more carriers are coming out with these HRAs, and they're paying the agent brokers additional money to have an individual go through one of these health risk assessments. And this is really what they're doing. They're trying to find out what if someone has a chronic condition, they want to make sure that they get that under care right away, making sure that they're taking care of those conditions. It's all around these star ratings. They're paying you an additional fee to get this information, but you can see that they're taking this information, trying to get the best experience they can with their client or with their with your client, and then to help the overall star ratings of the program. On the Part D side, and I'll show you a slide here in just a minute, that there's not near as many Part D standalone plans with a 5-star compared to the Medicare Advantage with a prescription drug plan. But a lot of the similar things that they're looking at is obviously the member complaints and the overall plan performance. What is the member experience? The drug pricing, patient safety, and then also the overall customer service. So again, they're putting a lot of these programs in place. They want to identify chronic conditions. They want to make sure that they're getting a jump on helping take care of of their member. So I mentioned before that there are more 5-star plans than ever this year. If you look on the left-hand side here, this is going from 2019 up to 2022. And if you just focus on this brown or rust color, you can see how many more 5-star plans are available here in 2022 compared to 2021. It was just a small amount there. And same with 2020 and 2019. So they've kind of stayed this pretty similar there. And then in 2022, we did see a big surge of 5-star plans. And I think some of it has to do with COVID and how CMS is overall measuring everything, because of COVID. On the right side of the chart here, if you again focus on this rust color, you can see that there is just a small amount of standalone PDP plans that are 5-star. So 2021, not very many. Most of them are going to be 3.5 or 4-star, 4-star plans. And what I will show at the end of the presentation, once we go through this, so it doesn't matter where you're located or where you're marketing, if you let us know, we have a program, we can show you anywhere in the United States down to the county level if a 5-star plan is available, and if it is available, what carriers are available as well. So the overall 5-star rating, again, it's rated from a 1 to a 5, 5-star being considered excellent. And again, it's overall was designed to help Medicare beneficiaries compare plans based on quality and performance. And I will say this again, you'll hear me say this a couple times during the presentation, just because a plan has 5 stars does not mean it's necessarily going to be the best plan for your client. You do need to do your due diligence and make sure that the providers, the prescription drugs all that stuff is also going to be, covered, for that plan.
Hey, Tim,
The,
sorry to interrupt. Before we move too far away from that last slide, there was a question that came in. Mary Lee just wanted to know why there are so few standalone PDP plans with 5 stars. Would you know the reason behind that?
Well, when they look at the overall measurements of it, I think, and you see, and you do see, like, each year you see more disruption on that PDP side of things. And I don't know the answer specifically to that, but my overall thinking is just because there are so many changes to PDP, so many changing between tiering. It seems like year over year, you as the agent are making more and more changes on the PDP side of things, just to, because the tiering changes, the cost structure changes, and things like that. It's just a lot of I want to say turnover, or a lot of having to switch those plans. But I'll see if I can get more specific information on there. But it's just when you look at the overall member experience, because prescription drugs are getting more expensive, new drugs coming out, they're paying a significant amount of money on it. Members are, if they're not paying a low copay, they're disgruntled about it, things like that. So there could be a lot of different reasons for that. I don't know if you can see this. I can't see my video on here, but on the this is a 5-star sheet here, and this is obviously in every sales kit that you have. And when you're looking at this, the plan will say 5 stars. It will have the logo here that plans can use to market. It's a star with like yellow around it, letting them know that it is a 5-star plan. And it is based on, again, a couple different factors: feedback from members about plan service and care, number of members who left or stayed with the plan, number of complaints Medicare got about the plan, and data from doctors and hospitals that work with the plan. So more stars mean it's a better quality plan, members get better care, and better, faster customer service. And again, just to reiterate, it is doing your due diligence to make sure that the providers and are in the network, and the prescription drugs are covered as well. So the enrollment period for 5 stars, it actually began on December the 8th. So the day after AEP, you can start re-enrolling individuals into a 5-star plan. This will go through November 30th. And then again, it's going to be effective the first of the month following the date the application was received. The nice thing about this is if you have a client that you weren't able to get to, and they may not necessarily be in the best plan, you have the option to enroll them into a 5-star plan beginning the day after AEP. So just some other things to consider. Again, if you are using that 5-star special enrollment period, I mentioned this before, not a lot of PDP plans have a 5-star, but if you are moving somebody from an MAPDP plan to a PDP 5-star plan, they will be disenrolled from that Medicare Advantage and going back to original Medicare. So just make sure that, obviously I know you guys are all aware of that, but I just wanted to make sure that, just to point that out. If you have someone going to a Medicare Advantage plan with MA only, with coming from a Medicare Advantage PDP, they will be disenrolled again from that MA PDP plan, and then they will lose that PDP coverage, and then will be subject to a Part D late enrollment penalty, by doing that. So just a couple pitfalls there to watch out for. Some of the other enrollment periods that are available, obviously you have the IEP, or the initial enrollment period, that is available In addition to 5-star plans, it is eligible for anyone that's taken out Part A and Part B at the same time. That includes the 3 months prior to them turning 65, the month of, and then 3 months after turning 65. That is always available. You can do that anytime, that they would qualify for that. The Medicare annual enrollment period, we just went through that. That's October the 15th through December the 7th. You also have between April 1st and June 30th, if you have somebody that has Medicare Part A and they did not, or delayed their Part B, did not sign up, and then they decided they wanted to take out Part B, they signed up during that Medicare general enrollment period, which is from January 1st to March 31st. That would be effective, their Part B would be effective July 1st. So you do have the option to enroll them into an MAPDP plan from April 1st through June 30th for a 7/1 effective date. And then obviously the SEP special election period, that is it could be for somebody moving outside the plan service area. We talked about the 5 stars, we talked about the OEP. If there's been a declaration, for a disaster area, we're starting to see a lot of those across the country, whether it's a flood, hurricane, fire, different things like that. Those are all can be done year-round with a special election period, if that is declared or they are eligible for that.
Tim, sorry, another question did come in. Charles wanting to know, what is the SEP code that's used for a 5-star if you sign someone up for a 5-star?
Great question. It is, there is one for 5 stars. So you just either check the box or write it in saying it's a 5-star. And you can only use it the one time throughout the year. So once somebody utilized that SEP code, then you can no longer they're no longer eligible for that plan year to access that 5-star SEP. Some of the other, and again, I just put Ohio and Northern Kentucky and then Florida. These are just some of the carriers that are available. In Kentucky, I know United Healthcare outside the Northern Kentucky it's available pretty much throughout all the eligible counties down there as well. And as I mentioned, I'm going to jump into a screen here in a minute to show you all the different counties across the United States. So if you have a specific county or if you're located in a specific area and you want to know what is available, feel free to give me a call. I'm happy to go through and we can put a plan together and show you what opportunities that there will be for you. So let's talk a little bit about some of the marketing opportunities here. So you can let your senior clientele know that SEPs are available and that you can enroll them in a 5-star plan if they switch. You can't specifically target lower rated plans or reach out to specific clients who enrolled in lower rated plans. You can't ask your clients to request an SEP. The main thing is when you're looking to do any type of marketing, keep your communications brief, informative, and then direct prospects and clients to call you for more information. When you are looking to put something together, please reach out to us. We're happy to review and make sure that your pieces are compliant when marketing for 5-star or, if you're looking to do any type of marketing whatsoever. Before I get into the plan locator, so I went out and just some of the other, this is under the Medicare marketing guidelines, some of the other things you can't do. Obviously, you can't mislead beneficiaries into enrollment plans based on inaccurate information. You do have to include disclaimers on materials specifically refer to star ratings. Must clearly identify the year contract. So because someone has a 5-star plan this year, it does expire, and those are all plans are reviewed again in the fall for the next contract year. So just because they were a 5-star plan this year doesn't mean they're going to be a 5-star plan next year. So you do have to specify the contract year. and when you're marketing for 5-star plans, you must market to the specific area that that plan is available in. You can't market to an entire state or a specific range of counties unless those counties have that 5-star plan available. Before I jump over to the to this pinpoint to kind of show you the carriers that are available on 5-star, we're going to be trying to do this these presentations just to keep you informed. We do have one set up on hospital indemnity. It's scheduled for February the 22nd, so you'll be seeing some information coming out regarding that. And we're bringing Jamie Sarno in to talk about the need for hospital indemnity. Not so much selling the product for hospital indemnity, but the importance of at least talking about it. You know, when individuals turning 65 or when they're rolling into Medicare, you know, this is probably one of the single most decisions they have to make, you know, and it's just something they have to make on their own. That's the importance of having you as the broker to help them. Because if you think about it on a group standpoint, the employer made the decision for them. And now all the coverages that they had when they were an employee, they're going to have to make all those decisions on their own. So Jamie does a phenomenal job in terms of talking about the need, you know, the changes each year with Medicare and why hospital indemnity is a great fit. And then we're going to conclude that presentation with showing you how to quote and also enroll into a Medicare, into a hospital indemnity plan. And it's a great tool to show you how you can put an MA plan and a hospital indemnity plan side by side, and you can show your clients firsthand how you can reduce or eliminate those copays. So we're excited about having that next month. So here are some contact information at the end of the presentation. I'm going to go over to this pinpoint first and kind of show you how that works, but then I'll bring this slide back up again. But here are the sales directors across, across our area here. Please reach out to any one of us. We're all here to help, specifically if you're looking for ideas to market for OEP, for 5-star plans, or just looking to generate, generate leads during this time frame up until this next AEP. We've got different plans, programs available, and we can certainly help you put something together to help you with that. So can you see my screen, Marilyn, with this?
Yes, I can.
Okay, so you can see on this screen here all the different counties that are available. So if I look at Ohio, for example, I can go county by county, and I can even make this smaller and just have the state of Ohio on my screen. But you can see in terms of by the color coding, if it's the gold or darker gold color, those are higher 5-star plan density there. So Northeast Ohio, higher density of people that are eligible for 5-star plans. And you can see with each specific county, it does show you the plan name that is available as a 5-star. So for Stark County, you've got United Healthcare, you got Medical Mutual of Ohio, and then you also have Primetime Health Plan, which is the All Care. And you can just go county by county and just to see the specific. So in Madison County here, closer to Central Ohio, it's United Healthcare, Medical Mutual are the two plans available 5-star. You look down in Kentucky, down here, you can see specific counties. Hardin County, it's United Healthcare. And it tells you specifically what plan. This is Plan 1 and Plan 2 in Hardin County. In southeastern Kentucky, same thing, Plan 1 and 2 with United Healthcare down there. You can see in Indiana, there are no 5-star plans available for 2022. In Michigan, up here, if you're doing any marketing up in the Michigan area, you can see, it goes to say Kalamazoo County, United Healthcare, Blue Cross and Blue Shield is available as well. So let us know specifically what counties, where you're looking to market. We can pull pull this information up, and we can help put a plan together for you to help market and increase your business here. Here's down in
So
Florida.
Tim,
You can see.
oh, yeah, Tim, so
Go
the
ahead.
idea is brokers, they have a certain service area that they work through and everything. They can give you a call or their sales director, or can they send an email and just say, hey, can you help me out and give me a list of the 5-star plans that are available? Is that the idea?
Yes. Yep. Absolutely. So here's our contact information. Feel free to reach out to any one of us. Again, we're here to help. If you do go to our website, which is cornerstoneseniormarketing.com, which is down here at the bottom, you can see under our agent toolkit a lot of the marketing plans or marketing programs we do have available. If you're looking to do any type of mailers, we've got several different mailing companies that we can help you with. It's 30 cents a mailer, so for a 1,000-piece mailer, it would cost you $300. We also have direct leads that you can purchase. If I know a lot of the mail returns have not been as great right now, we can purchase specifically leads that are already generated. So, for example, for $300, you can get you can get guaranteed leads versus doing a mailer and may not get as many leads there. We do have co-op dollars again available to help and that. So just please reach out to any one of us. We can help put a plan together and help you grow your business for this upcoming year.
Tim, just a few questions that have come in during the presentation. But first, what is the turnaround time on getting those 5-star counties? It's pretty quick, right? I saw how quick it was on the map. So if you called, Jamie or somebody up and said, hey, what's available in this county, turnaround is minutes kind of thing? If you're
Yeah, I mean, literally, if you call us, we can pull it up as you're on the phone, and we can specifically tell you what is available. We can do a screenshot and we can send it to you as well on there. So it's a very, very quick turnaround. If you send us an email, we'll respond right away and list out the opportunities there for 5 stars in your area or your area you want to market to.
So, and I want to thank Susan. She posted in the chat box as an FYI that All Cares form does not show the 5-star SCP on their form. So if you're writing an All Care 5-star, it needs to be included in a note when the form's submitted. And then and Susan did mention that they're working to correct this. So thanks so much for that tip, Susan, about the All Care application for a 5-star plan. And then one more question from Charles. If a person signs up, Tim, for a Medicare during the general enrollment period, would the enrollment into a Medicare plan be guaranteed, or do they have to answer medical questions?
To my knowledge, they could go ahead and enroll into if it's a Medicare Advantage plan, then they can enroll into that Medicare Advantage plan. If it's I'm not sure if he's asking specifically Medicare Advantage or MedSup, but because they would just be taking Part B, he would have the ability to, he or she would have that ability to sign up for that Medicare plan.
I do think we covered this, but can you enroll in a MedSup member in a 5-star plan? I don't think there are MedSup 5 stars, right?
No, it's only the prescription drug plans or the MA PDP
right.
plans or MA only plans.
Right. And a handy tip too, we have the 5-star plan locator that Tim talked about. We're happy to help you with that. And the advantage of doing that when you talk to us is, of course, we can help you put together a good plan if you need some help with that about marketing to that area that has 5-star plans available. But we should point out, thank you, Charles, that 5-star plans by zip code are also on Medicare.gov. So that's helpful too. If it's on a weekend or something, you can't get a hold of somebody. That's an alternate resource as well.
Yeah, and I will point out too, and that's a great point, Charles. If you are using Medicare Center, you can go into Medicare Center and you can pull up and you'll see the star ratings for every plan. So again, that's available in all 50 states. And you literally can put in the zip code of an area, and you can pull up, you can see the plans, you can see what star ratings each of those plans have as well. But in general, if you're looking to say, hey, I want to market in Florida, instead of trying to go through and search different counties in Florida, let us know. We can show you on that pinpoint map specifically what counties, what plans would be available as well.
Perfect. So I'll reiterate for Rick, you had the question, do we have access to the 5-star map or do we need to contact you? Feel free to contact us anytime to get that information. Alternately, you can go onto Medicare.gov and use the zip code, and they will pinpoint 5-star plans for you by zip code. And then,
yeah, we were hoping that we would be able to share that link with it, but we're not able to share that with everyone, that pinpoint link there. So if you want, just give us a call. We can even share our screen and we can go through kind of what we're doing here. We can just do it one-on-one. We can share a screen. We can show you specifically what counties and what states are available for what plans.
Awesome. And Tim, the general enrollment SEP, is that only the general enrollment SEP? Is that only for MAPD, no, not for PDP?
They would have the ability to enroll into a PDP plan at that as well.
Okay, perfect. Susan, I hope that answers your question. And then Carla, you just reiterated, I know we've been through it, MedSup member, can a MedSup member change to a 5-star MAPD? Or is it just MA to MA or MAPD to MAPD?
That individual would have the opportunity to move to a 5-star plan if they're on a MedSup.
Perfect, perfect. All right, and let me just check one more spot here. Okay, I think that's all the questions so far. If anybody has anything else, feel free to type it in the Q&A or the chat box. But that's all I see so far. Okay.
I just noticed on this screen, if you're looking at our general phone number, it's area code 614, not 615.
Yeah,
but again, just
right.
give us a call, any one of the sales directors a call specifically, and we're happy to answer and help you, put a plan together and answer any other questions that you may have. But if there are no other questions, we do have some handouts that I can send you as well. It's kind of a summary. I think we can also send out a copy of this presentation if you'd like. Just send us an email. We're happy we can get you this information. This presentation is being recorded, so it will be out on our website. Feel free to go out and view it at any time that you wish as well. I appreciate everyone's time this morning. Again, good luck this year, and let us know how we can help you. Thank you.